Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, a Changing America. I'm Anthony Moreno. Today we discuss Latinos and mental health. Joining us in a few minutes will be Fred Sandoval, Executive Director with the National Latino Behavioral Health Association. The organization serves as a voice across the country for Latinos and mental health and shines light on research and best practices. But first, we take a look at growing concern about a Las Cruces hospital that's still without its psychiatric ward. KRWG's Johnny Coker has the latest.
For Sylvia Ramirez, the lack of mental health facilities in southern New Mexico makes finding help for her family a struggle. A Las Cruces resident and a housekeeper for Memorial Medical, she said that her family suffers from psychiatric problems, including her son, her mother-in-law, and her then-fiancé, who passed away in 2009 after battling mental illness and addiction. Ramirez said that the closure of Memorial Medical's psychiatric ward creates barriers for residents with mental health emergencies, and that having a resource for individuals in crisis should be a priority within the community.
We need the services here, not just for me in general, but for the community. Definitely for the community. There's so much help that can be done just by opening that one facility. You do have those situations where a person is going through a tough time, and they need that emergency service, and there's nothing. Back when it was open, at least we did have that, where we can go get the help that we needed at that time, but now, it's really hard.
Memorial Medical Center closed their psychiatric ward in August of last year. According to their lease with the city and the county, quote, if leasee ceases to maintain the hospital as a full-service general acute care hospital by not sustaining the same types and level of service as currently provided, leasers shall have the right to terminate this lease or retake possession of the premise by eviction, reentry, or otherwise. When KRWG reached out to Memorial Medical CEO John Harris, a spokesperson said he was not immediately available for an interview. However, in a written statement, the spokesperson said, quote, the decision to close this floor was not taken lightly. A provision of these services has always been based upon being able to staff this unit appropriately and safely. Once this has been achieved, we look forward to bringing these services to our community. Peter Goodman is a Las Cruces resident and has written about this issue in his weekly column that appears in local news outlets, including krwg.org.
They claim to be near a solution, which is great. The problem is that a year without a mental institution creates so much harm. There are a lot of people that can't go to El Paso. There are a lot of people, you may know some, who are in a situation where they function borderline on the street or in their home.
Goodman said that he's pessimistic about Memorial's reasons for closing the ward.
We're seeing a private healthcare entity make decisions based on profit, and some other things they want to do, maybe new things, are more profitable than the fifth floor, which is a duty under their contract and a duty to the local humanity. And that takes a back seat. It seems, certain people who know more than I allege this, and it seems that way to me, that what the people need and what is required under the contract is taking a back seat to other endeavors.
Shannon Reynolds, Doña Ana County Commissioner for District 3, said that while Memorial may be in violation of their lease, it's in the best interest of the county to not pursue any legal action.
We have the contract. We can act on the contract. The problem is do we act on the contract to the point where we put them out of business? See, that's a delicate balance that we also have to consider. We need the services, we need the hospital, and we don't want to force them into a corner where they have to say, well, I give up. So we need them. We need to be a good partner with them. What I would say the best solution to this kind of problem is more competition. So if rather than having only one facility that can provide the service, we need multiple facilities that can provide the service. That also goes back to the economic atmosphere of the community.
As for Sylvia Ramirez, she said that she's hopeful for the reopening of Memorial Psychiatric Ward, but agrees that more needs to be done in terms of attracting mental health services to the area.
If my fiance at the time would have had the right counseling, the right assistance, maybe he wouldn't have gone into addiction and try to cope with his mental illness that way, and maybe he'd still be alive. You just don't know, because there was never those services.
Memorial Medical Center told KRWG that they are close to reopening the psychiatric ward, but could not give an exact date. For KRWG Public Media, I'm Johnny Coker.
Moving on, we now discuss issues involving Latinos and mental health. Joining us is Fred Sandoval, Executive Director with the National Latino Behavioral Health Association. Fred, thank you so much for joining us.
Good morning, Anthony. It's good to see you, sir.
Can you start off by sharing with our audience a little bit about your organization?
Sure, absolutely. Thank you, Anthony, for asking. The National Latino Behavioral Health Association is a nonprofit organization that actually came from the National Hispanic Mental Health Congress. In the year 1999, President Clinton organized a national forum to bring national leaders in behavioral health from the Latino community together to bring forward recommendations about what to do with Latino behavioral health in the United States. One of the recommendations was the formation of a national Latino Behavioral Health Association, and thus this organization. So that's the origins of our organization, and our mission and our vision, of course, is to address the great disparities impacting the wellness and the behavioral health of Latinos across the United States.
What does your organization feel is the greatest need right now when it comes to getting quality behavioral health care to Latinos across the U.S.?
Oh, great question. Powerful question, too, by the way. Well, significantly, we have two particular things I want to mention. One is the limited access to substance abuse services in the United States for Latinos. Only 1 in 10 over the age of 12 are getting access to substance abuse services. That gets a little better when it comes to mental health services, but that would be 5 out of 10. We have a great ways to go to be able to ensure access to quality and culturally and linguistically appropriate services for Latino communities across the United States. So right now, that's probably the most significant. The other, of course, has to do with the lack of connectivity to resources that do exist. And the question is, how do we overcome the barriers and the challenges associated with that? And that's part of what we look at here at NABA, is to address what those barriers and challenges are, because they are inhibiting, making it difficult for Latinos to get services when they do need them.
What do you think are the greatest barriers right now in preventing people from getting access to care?
Well, believe it or not, the lack of education and information. At the community level, we simply continue to hear individuals not knowing where to get help, how to get help, and who it is that's available to help them when they ever do present with situations where they need to take care of their emotional well-being. So that lack of information and education, despite as basic as it is, it's still a very significant issue in our country. We also see, of course, other things having to do with things such as language access. Because Latinos, of course, speak more than one language, right? More than English. That means that they're going to have the need for language access to get quality care. So it starts with language access, and we're starting to see that gap is starting to widen in light of the fact that the Latino population is continuing to grow bigger. So does the language access gap. So I would say that when we start to look at the quality of care, we know that many of the programs that are being offered to Latinos were not designed, developed, or evaluated for that population. So there's a great need to actually have evidence-based programs for Latinos and their behavioral health.
What examples are there out there for us to really look at and possibly say, we're having success with this approach to get more Latinos seeking behavioral health care and substance abuse care?
Well, great question, Anthony. You're absolutely right. The question is, what are some of the successes that we're having? So we are seeing those too. So it's important to highlight the achievements, the successful efforts across the country to ensure that Latinos can get access to services. While we're certainly seeing in this generation, certainly in the last 20 years, there's been a proliferation, an increase in community-based organizations that are attending to the mental health of Latinos across the United States. So as the population has grown, so has the community efforts to address the kinds of wellness issues that impact people who are migrating across the United States, individuals who are moving to states where there were fewer Latino populations. So we're starting to see more community-based programming to provide information, education, treatment services, outreach into the Latino community, getting the information and education out in the community, not keeping it inside of organizations, but getting out into the community. So we know that the outreach efforts from promotoras, community health workers, as well as peer specialists are a good example of how to proactively get the information out to community rather than passively waiting for services. That's an effective way of engaging the Latino population and having people who are bilingual interact with that population because they know their needs, they're trusted, and then they can engage them into different kinds of programs and practices, many of which are very appropriate for Latinos. And some of these are evidence-based practices, others are promising approaches, but what's important is they were really intended to serve the Latino population. So we see that there's an increase in that effort. On the program, for example, that we use is called Familia Adelante. It's a prevention program that helps to look at the needs that are unique to the Latino population, whether it's in New Jersey, Florida, Texas, California, Nebraska. These programs are really designed for them. So we're starting to see an uptake in the number of evidence-based programs for Latinos in order to help ensure that their needs are met just as well as the rest of the population.
There's been a lot of talk about the stigma surrounding behavioral health care amongst Latinos on this program and others. Can you share with us a little bit about how much that stigma exists today?
Anthony, thank you for asking that question. Well, stigma historically has always been one of the most significant barriers and challenges to anyone trying to get behavioral health care. So in the United States, we have a national issue, and that national issue is that stigma is preventing people from getting care. The stigma, the way it looks is people are basically shunned or treated differently or looked down upon because they have a condition that is impairing their emotional well-being. For some people, those situations may be situational. Others, it may be chronic or long-term conditions. But in every instance, our country is still struggling with trying to ensure that if you need care or intervention for your emotional well-being, that you should be able to get that just as equally as you can for healthcare services. But the stigma is actually oftentimes the one single barrier that keeps people from getting services. And in the Latino community, for instance, we have two stigmas, right? We have the stigma that's associated with the larger population across the country about individuals with mental health issues. And then in the Latino community, we have our own terms for identifying people who have mental illness in ways that can be inappropriate, condescending, or very mislabeling it. And the end result is that we have to make every effort to inform and educate each other on what it is that happens when people who need mental health services. It isn't because they're crazy, right? It's because their emotional well-being is eminent. It means it's something we need to take care of. Because by ignoring it, these conditions can worsen if they're not treated or diagnosed. And so what we want to do as a country is ensure that any individual who is struggling can have access to care so that we can achieve two things, equity and parity. So that this way, any individual, regardless of your race, your background, your religious beliefs, your creed, your geographic nation of origin, can get the kind of help that you need in order to have an emotionally well-oriented society.
Now, you mentioned disparities that exist with Latinos being able to seek care and treatment. This is an ation that many communities are dealing with across the country. When you look at New Mexico, what are some of the top barriers that you're noticing that are impacting this issue?
Well, here's what's happening in our country. We are now experiencing three things. We're experiencing a greater knowledge about mental health. So our awareness is increasing. That's an excellent place to be because we want to ensure that everyone understands it when they see it. And then we also see, of course, that one is individuals who are looking for help can get it. Because what happens is being aware that you're in need of help but unable to locate that service means that this barrier of lack of information needs to be addressed so that individuals not only are aware of their circumstances, but can be informed as how to get help and be assisted in doing that. Because the whole idea in New Mexico is how do we increase services to a population that may be underutilizing them. What we want to do is ensure that any individual can get these services. So in New Mexico, we're starting to see an uptake in funding for behavioral health services. And while that is excellent, what we're also challenged by, Anthony, is a situation where we're having a shortage of behavioral health clinicians. And we just heard recently that in a study conducted with the federal government that we're actually starting to see that many people in the field are already contemplating leaving the field. That should be worrisome for all of us as policymakers or policy implementers, because what we want to ensure is that there is access to services and thus the workforce that's needed to provide those services. The pandemic really proved to show the vulnerabilities in our country because of the way the workforce was stretched beyond measure. It really led to a very distressing and stressful situation for many of behavioral health workers. So now the behavioral health of our behavioral health workforce is eminent. We need to address those kinds of issues, and we need to develop programs such as our scholarship program to bring in new college students into the workforce. And the way we've done that through scholarships, we have 97% of our students here in New Mexico getting their college degree in behavioral health and going on to pursue their careers in behavioral health. So just as there are problems, Anthony, there are solutions.
Well, there's a lot of excitement about the scholarships, of course, as long as the funding continues to support those. But I'd also like to hear a little bit more about workforce concerns. Are more Latinos going into the behavioral health care field?
Well, believe it or not, here's the dynamic that we have seen happen. We've actually seen firsthand that many of the new immigrant students that are coming to the United States have gained a great interest in the mental health field. And it's because of something that's unique for the immigrant population. The immigrant population, unlike many other groups, experiences a higher level of stress levels. It's because of the nature of what happens when you're moving from one country to another in and of itself that creates stressors that the young immigrant population is very cognizant of. So they have taken a keen interest in understanding that stress is impacting their well-being. But it also has piqued their curiosity to say, what can I do to address my own stressors? But yet at the same time, how do I play a role? And that is entering the higher education disciplines of psychology and social work. So we're actually seeing an uptake of immigrant students now studying behavioral health. And as I said, that has influenced us so much that we've started working with the Mexican consulates across the United States to match their scholarships with ours. And the reason why is because there's an interest in the Mexican community about behavioral health and mental health because their situation has been impacted by the pandemic. And that greater awareness now is mobilizing people asking for information about mental health resources, asking about how can we do something about these kinds of situations. All of that is pointing us in the right direction, is let's continue to recruit even younger individuals, both residents and potentially DACA students and others, to enter into the field because it helps mitigate the very stressors that they're experiencing.
We hear a lot about mental health during, of course, because of the pandemic. A lot of folks started talking about their mental health in different fields like healthcare and as well as education. How do we go and have productive conversations about trying to find solutions based policies when it comes to addressing mental health across the country?
Well, great question. When you think about what we're being confronted with as a nation, we're hearing this conversation happening at the kitchen table, at the restaurant tables. We're hearing these in community forums. We're also starting to take efforts to educate and inform the community. Our organization, for instance, does something called pláticas. These are conversations that help bring forward these issues and topics so individuals can hear about what they're experiencing by us having this conversation. And this particular example of the show that you're now producing is a perfect example of how we broadcast this information. And you can do it in English and Spanish. And so what's important is being able to have a conversation about something we're all experiencing, normalizing the conversation, because then as we talk about the issues, we also talk about how to get help, what those resources look like, how do we leverage the existing support from our families, right? Because the families are the natural support system. And oftentimes, the family itself is trying to understand how do we grapple with these stressors that are impacting our finances, our ability to hold jobs, and deal with the stressors impacting our children. And so all of those conversations now can lead towards open and very trusting exchanges about something that's very deep and personal. Because grief, for instance, is impacting the Latino community in this country unlike anything that we've ever seen. And the reason why is because of what's happened, not only because of the pandemic, but the fact that there are now an increase in the need for behavioral health services, because as folks are experiencing multiple stressors, the use of drugs, and then most recently with the issues having to do with such substances as fentanyl, we now know that we are all at risk. So how do we leverage the protective factors? Well, we start to talk about what works, what helps us, how we can cope with these situations, how to get help, because there is professional help that is available to us. So we want as a Latino community to have this conversation just as we would in our homes, because the safety and the privacy of behavioral health services protects your security and your safety and your confidentiality.
We just have a little over a minute with you, but I'd like to hear your thoughts on this. The Latino population is so diverse. You know, it's not like a monolith. I mean, it's a diverse community. So when you're talking with policymakers, how do you convey that message to them that there's a diversity within the culture that they need to understand when it comes to addressing these issues?
Great question. And in fact, it's really critical that we ask these kinds of questions, right? So collecting the data about who do we serve, right? So when you say Hispanic and Latino, what does that really mean? And we know that that represents different nations of origin from throughout Latin America, South America, Central America, Mexico, all of individuals who over time have migrated here. But for many of these groups, they've been here for a very long time. In New Mexico, for instance, my family history goes back, well over 400 years. We have pockets across the country that have been here even prior to it being the U.S. So we have a long history in the United States, as well as our immigrant populations of recent years. All of that to say is their needs are unique to what it is when you migrate to the United States, or what it looks like when you've been here for generations. Those stressors look very different because the acculturative stress is going to look different, first of all. And then we have also studied and found that many immigrant populations, the longer they stay, the more stressors that they develop that are unique to the American society and American culture. So now how do we develop programs that address those particular needs? Because when you speak about Afro-Latino populations, that's very different than talking about the Chicano population, or now the emerging Latinx population, or the long-standing Mexican populations that have been in the U.S. for centuries. So what we want to be able to do is start to look at those unique needs, the linguistic characteristics, the type of stressors that are unique to agrarian, urban centers, the frontera. All of those are very different. So it's important for us to look at the unique characteristics of those populations, wherever they may be. New Jersey, New York, even Missouri, Iowa, Minnesota, California, right? Those differences matter. And they matter because we want to understand what they're experiencing and what those disparities look like, so we can in fact, develop programs to improve people's well-being.
Okay, Fred Sandoval is Executive Director of the National Latino Behavioral Health Association. Fred, thanks for joining us. There are so many artists who share their talents with us in the borderland. In this segment of Living Here, our producer Christian Valle introduces us to Laurel Weathersby, a local artist that dabbles in watercolor and water media collages.
I work in basically water media, but that also, for me, includes watercolor collage. And I don't know if someone else ever used that term or not. I call it that because the materials I use are all water media materials. I use only watercolor papers and watercolors to color the papers with. I'm an expressionist. I'm not a technician. I think there's a really big difference. It's not that one is right and one is wrong, but I don't pay very much attention to technique and how other people say things should be done. I'm very much an expressionist. Inspiration and creativity come from emotional triggers. And for me, the emotional triggers are my environment, the things, the places around me. Sometimes it goes really fast, sometimes it takes weeks and weeks. So I don't think you could probably produce anything in less than 12 hours. And I doubt if I've ever put more than 6 weeks into something. One that I'm working on right now, I'm pulling together some pieces from other projects that weren't real successful, but there were things about them that really turned me on or spoke to me, I was able to say something with. I'm going to call it Moon Dance. I already decided that. Still working out the design, but I'm real pleased with the basic idea, which has to do with nighttime, spirituality, fertility, that kind of stuff. I want to make art that people can connect with, that they recognize something in and can look at it and say, oh, I know what that means, I understand that. Artists are different from other people in only one way, and that is they're people that are not afraid to make mistakes, not afraid to make a fool of yourself. If you're worried about being foolish, you're not an artist yet. I do have a blog. It is teacupinspiration.blogspot.com. And it's really all about inspiration and creativity, what makes people want to create. And I use my own examples to connect with people. Honesty about your feelings is what's important. Follow your heart. Don't do what someone else tells you is the right thing to do.
That's it for this week's program. Thank you for joining us for Fronteras, a Changing America. I'm Anthony Moreno. We'll see you next time.